welcome to the pod. I'm Nathan Fink.
I'm Jolyn Drennan, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the show, I'm joined by Robin deAlmeida from the Parent Information Center of New Hampshire. We talk parenting and voice. Later, Dr. Erik Shessler, pediatrician at Dartmouth-Hitchcock, joins us to talk about the intersection of parent engagement, family voice, and service provision. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. Today's show is also brought to you by New Hampshire Children's Trust's 9th Annual Summit, Parents Leading the Way. On September 22nd, the Children's Trust will be hosting an engaging virtual experience, convening parent leaders and professionals from across the Granite State to showcase the work of parent leaders and the agencies that support them. The focus? Parents as experts of their own experience using their voice to advocate for their families, improve their communities, and build more family-centered systems through policy change. Sign up now at nhchildrenstrust.org. For the first time ever on the show, we have a guest co-host, Robin deAlmeida, Projects Director of Communications and Family Engagement at the Parent Information Center of New Hampshire. Robin, thanks for being on the show.
Thanks for having me, Nathan.
I do have to say this is a historic moment, so I thought I'd give you some advice. Just deny. So we've been working on and off now for how long?
I want to say 2 years.
It's interesting because I think our intersection has been kind of at the behest of, different funders and things, and we kind of find ourselves nestled in this pod of projects. Yeah. So how is it going to be involved so far with another agency?
I think it's a model for what we all want to do going forward, right? Like you and I connected over our areas of passion and work and figured out how we could leverage each other's strengths to expand both organizations' capacity. And I think that is such a unique opportunity, but one that should be replicated.
Yeah, me too. I can't say enough about our working together thus far. And your work, of course, in your history and your life has led you to voice. I'm so curious, what brought you to PIC? How did you arrive there working in that capacity?
Well, it's definitely my experience raising my children in New Hampshire. As soon as my children were in preschool, I began volunteering in the school system. I, read all the parenting books and really considered myself a well-informed parent. But when they started to struggle in school, I really felt lost and frustrated and unheard. The parenting books and the parenting blogs, they don't really talk about family engagement or family voice, what that means, what it should look like, what it should feel like when it's really authentic. When you're neck deep in that early childhood parenting journey, this kind of stuff is really unfamiliar territory. Anyway, long story short, I saw a need for better communication between providers and families. And so I left my corporate marketing career and made it my mission to make information about navigating and engaging with systems easier to understand and more accessible for families in New Hampshire.
When you said frustrations, I'm so curious because you actually changed your entire career to deal with this. Is there any specifics in your son or daughter that made you say, oh my gosh, I need parent voice. I need to be an advocate for this?
A couple things. One was, as someone who's used to really sourcing information in my job, right? I couldn't do it well for what I needed for my kids to navigate the early childhood system, to navigate early supports and services, and then to navigate special education. And so I always thought if we just talked about it a little bit simpler, if it was just the conversations were just a little more accessible or the relationships were easier to build, this would be easier for everyone, And I remember starting to go into IEP meetings and say, can we just talk about this a different way for a minute? And really starting to find my way, taking the communication from another angle. And so what I did eventually was to really train my kids up on family voice. kids. So by the time my son was in 6th grade, he was running the IEP meetings. He was setting the agenda for IEP meetings.
And what just IEP?
Oh, sorry. Individualized education plan. So that's in special education. It's a plan to help your child meet his learning goals or her learning goals. Yeah. So just learning how we can use our voices to build relationships, to build trust, and then build teams to get the kind of care that we wanted for our kids.
A couple of things come to mind immediately. One of which is the obvious, getting out of the way of your kid's experience to give them the tools to build that experience for themselves.
It's huge.
The other is this idea of wanting it better for your kids than you had it. Now, how does that play against your sensibilities? Because you see your child, and I see my child in any sort of duress, including under the weight of information. I want to clear it out of his way. That's an instinct, and it's not a bad instinct, but it's also a disruptive instinct.
It is. And it gets in the way of, I think, our kids developing agency in their own lives and becoming leaders in their own lives. And it starts really early. We as a family would talk a lot about what's my responsibility in this educational relationship, meaning my kids' responsibility, right? The IEP, the plan, they need to know it because they need to know what they're responsible for as far as reaching those goals and identify very clearly what you need help with, what you're struggling with. So for example, my son would go in and he would have a bulleted list for each subject. And he'd be like, here's what I think I'm doing well at. And I think I do good on my own. And here's where I need some help. And the IEP meeting was like just a game changer. All of a sudden it really became about him.
That's, again, IEP. I'm not going to be dealing with that for some time. So I'm thinking about, okay, Mike, great. I'll call you in 10 years. But all of a sudden I keep thinking about it like early education. I have a tendency to put my son's socks on because his feet are so cute.
They're so not cute when they're 16. I'm just going to warn you.
So, but I'm thinking about that as like, okay, voice, the expression of the self, working through something, but utilizing your own strengths, your own agency, wherever you see fit. Are there ways as we go to build up the potential for voice?
So I think the big area of focus there in early childhood is helping kids build self-awareness. How am I feeling in this situation? Can I talk about how I'm feeling in this healthcare situation, in this educational setting? And if they can start talking about how they feel and then articulate why they might feel that way, I think that's the goal in early childhood as far as voice goes.
Now that's coming from obviously a parent perspective, industry perspective, right? How's your perception of family voice changed now that you're in this particular role?
So, I'd say the number one thing is that my realization that family voice is really critical to ensuring that education, healthcare, and family support services remain accessible and responsive to the families who use those services. And two, I've learned, I'm not from New Hampshire, but I've lived here for 20 years. And I've learned that we are really fortunate that our state values authentic family voice and builds opportunities for families to share their experiences, their wants, and their needs.
So, as a father myself, I keep thinking about family voice as something that I need to cultivate. I keep thinking about my sons and their ability to navigate whatever comes before them, whether it's the education system, healthcare, family resources. And I'm not sure I know how to, one, identify it, and then two, access it. So where are the opportunities?
The thing is, because we don't always talk about family voice and family engagement in a way that makes sense to families, a lot of us as families don't know how to look for those opportunities that are out there. But every interaction with a systems professional, whether it's education or healthcare or family supports, behavioral health, whatever, every interaction is an opportunity for family voice. It's an opportunity to share your vision for yourself and your family. It's an opportunity to figure out how to take the care plan they're designing and align it with your vision and your goals.
Yep, exactly. We're going to take a short break, but when we come back, Dr. Erik Shessler, pediatrician at Dartmouth-Hitchcock, joins us. Don't go anywhere. Today's show was also brought to you by the Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy and Protection Program, a multidisciplinary program with the Children's Hospital established to evaluate and provide integrative care to suspected victims of child maltreatment. Together, a team of physicians, advanced practice registered nurses, social workers, nurses, and child life specialists work to provide consultation and evaluations of children who are suspected victims of abuse, so to serve in the best interest of children and families at multiple levels of prevention. For more information about Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy Protection Program, visit www.chadkids.org/child-advocacy. This podcast was also brought to you by the Parent Information Center and New Hampshire Family Voices, which are statewide organizations that have been working with families, children, and the professionals that support them for over 40 years. They provide information and training to help families, providers, and systems builders make informed decisions so that New Hampshire families can get the support they need to see their children thrive. To learn more, go to picnh.org or nhvf.org. We are pleased to introduce Dr. Shessler, pediatrician at Dartmouth-Hitchcock and all-around advocate for Family Voice. Obviously, Robin and I are here to talk about Family Voice. So when I say voice, what does that mean to you in your practice, the provision of services in medicine?
Sure. When I hear kind of that phrase family voice, I kind of like to think about the fact that when I work with patients and families, what I'm really trying to create is kind of that therapeutic relationship. And in any kind of therapeutic relationship, we need everybody's input. So as medical professionals, we have the habit of really focusing on the things we're saying, not necessarily really taking the time to listen to patients and families, not just about their acute needs, but just kind of a little bit more globally. Like, what are they looking for when they come to the doctor's office? What are they looking for us in an office? How can we improve their, kind of individual patient, but the family health, and kind of think about it a little bit more as kind of a whole person piece. So if somebody comes in for an ear infection, we are often very task driven. Okay, your ear hurts. That's great. Let me see if I can figure that out and, solve from there. But what's kind of the bigger picture that often kind of goes on there? Is that impacting the family's sleep? Is that now impacting everybody else? Other things that are going on within those family dynamics, that kind of piece. So when I think about family voice, we need to make sure that we are equally valuing, at least if not more, making sure that we're getting that patient and family voice in what's really kind of going on.
And how does voice practically improve the services you're delivering?
Again, as medical professionals, we have a habit of creating these quality improvement projects because we think we're going to improve the quality experience for patient and families. And then we totally forget to ask the patient and family if this is actually improving quality at all. So, we have this one-sided vision. And so it's really nice to be able to say, like, hey, what do you see as improvements and things that we could be doing differently? What other better experiences have you had in other places? How can we learn from, kind of what ideas you guys have, what, experiences you've had, both positive and negative, so we can do more of the positive things and make sure that we're addressing the negative things in one way, shape, or form. And without having that family voice, we're completely guessing. One quick anecdote, we did a project at one point trying to help decrease our no-show rate. And so, it turned out that the efforts that got put into it, and there was a lot of work that was done on kind of our side to figure this out. What we ended up doing was, some version of like families couldn't schedule appointments, but they could kind of arrange, if they called us, we could do it within 48 hours, but they couldn't pre-schedule because every time they pre-scheduled, they wouldn't show up. And so it ended up being an interesting thing where we actually were giving them way more access, but it was creating this barrier with that when they called, they couldn't actually schedule something. And so we, it had some cool background pieces to it. I presented to the Family Advisory Committee and I immediately got a whole bunch of answers like, that is going to fail the instant you throw this, you pop this up. And I'm like, oh, well, we should have asked you before we actually did that. And so I think it's one of those, it really does change a great deal of our practice piece to be able to say, hey, any quality improvement project, we run through our Patient Family Advisory Committee, make sure that they're on board. We just opened a new building that's in the, behind the primary care building here in Manchester. And so then it opened up things like, hey, are the signs actually correct? is it confusing for you to get from point A to point B? Like, we just doubled our square footage. And so that's twice as many places for people to go to potentially the wrong place. As we're working through the various things with COVID, as we're working with the various things with the new building, that folks actually know where to go. Those little experiences that make such a massive difference, that is all before you ever actually see me. So before Robin and her family actually sit down to talk to me, you got to actually get to where you're supposed to go. It has to be clear that you got there. You have to get roomed in checked in an effective manner. You have to get roomed in an effective manner, all before I get there. And so a lot of times families are, distressed by any of those things that beforehand, and then you may not necessarily have as good an experience with me as we would like, just because everything around it didn't go as well as it was supposed to.
So, my son had just recovered from COVID, and I was really worried about him, missing school his freshman year after all this time in remote learning, not being able to play sports, which is really important to him. And I just know myself, if I was having a hard time navigating a new wing of the building on the day of that appointment with you, Dr. Shessler, it would have stressed me out before I even made it to the exam room. And I wouldn't have remembered all the questions I wanted to ask or understand the back to school or sports protocols. Because when you experience stress, your ability to focus and retain information is hindered. So having families give input on something even as simple as signage to inform that user experience, it's just critical to having optimal healthcare experiences. Are there barriers in the organizational culture that healthcare providers need to overcome to fully embrace family voice and inform the delivery of care? Or is there lack of awareness about family voice and how to embrace it?
I think it's both. And it's, I'm smiling as you ask the question kind of thing, because the folks at New Hampshire Family Voices know this specifically, which is why New Hampshire Family Voices has to exist, because people aren't necessarily aware that this is the case. So, when we started the Patient Family Advisory Committee, for example, we had to train the different visitors from the healthcare system to come in to do this. And hey, no, you have to figure out how to work with families so you can harness the feedback they're giving you so we can actually make positive kind of sessions. We also work and train kind of from the family's point of view too. And so how do we harness that feedback that's really important, on the negative or positive side into, we've been able to make changes because of this. And you can imagine the group loves getting a chance to say hey, we complained bitterly about how the online portal worked. You guys built it so it worked really well from the medical side, but you didn't build it so it was useful for us. And then we got back in the trip look, because of what you told us, we changed this and this and this and this. And it's a wonderful feedback loop. And you can imagine it also helps us from a selfish standpoint, besides the system being better, that those families then go out and, proselytize hey, they listened to me and they actually changed things because I told them, you should send your kids to that place too. You should send your family to go do that kind of piece. So, but it does involve that little bit of a culture change. I will say primary care providers tend to be a little bit more primed to listen to this, just because we do kind of that ongoing longitudinal care. We get a chance to know our families a little bit better. And, a major piece of that is active listening and figuring out hey, meeting families where they are so we can actually be able to have the outcomes that we're looking for, that not everybody's outcome is exactly the same. You got to figure out where the family's looking to go. We shouldn't ask after. We should be asking before we do anything, and they should be involved in the planning from the get-go. And I will say that there's been a lot of positive change in that through, Dartmouth and, through, I do a lot of work with the New Hampshire chapter of the AAP, so the American Academy of Pediatrics. So I'm the New Hampshire chapter president, and so I get a chance to do national stuff. There are now patient reps on our New Hampshire chapter board. There are patient reps as part of the American Academy of Pediatrics at the national level kind of thing. There's a lot of work making sure that all of these committees and all of these projects have a patient and family voice involved from the get-go, because we need to do a better job of involving families as we go. And it also is such a phenomenal way of catching everybody saying we do horrible acronym soup all the time, and the language doesn't work very well. And then it's just kind of this nice check of hey, if I don't get it, then chances are a huge number of the people you're trying to communicate this to aren't going to get it either. And you need to do a better job. And there are such depressing studies and facts to show how little people understand when they walk out of the doctor's office if you actually ask them about what just went on. And that's a term called healthcare literacy. The big key with healthcare literacy is if you don't understand what families are looking for and what level they're at, then you can't, kind of change the message so that you actually get to a better understanding kind of overall.
That's a brave and vulnerable position for professionals to be in, to encourage people to use their voices. What do healthcare professionals need to feel safe in working with families to create space for family voice?
I get a chance to do this a little bit more often, so it's a little bit smoother and more a little bit more secondhand. But I think partly the answer is we should all, as professionals, recognize what we know and what we don't know, and so that's important regardless of what your profession ends up being. And so in this case, what am I bringing to the table during those conversations? And in this case, I'm bringing some of the medical expertise and the knowledge of how the healthcare system works and what things I can change and what things I can't change. That's kind of my, kind of area as I walk into those discussions. And so when I'm working with families, it's that acknowledgement that, hey, I can't necessarily fix everything you might mention, but first of all, I'm going to listen. And that's extremely important for us to be able to go from there and then kind of say like, hey, here's what I'm hearing at the time. And now let's see if I can match the kind of things that I do have control with being able to fix. And then certain things that I don't necessarily have control with being able to fix. Families really tend to respond to that like, you heard me. And I fully understand because of the way you're describing it to me. Now that you've given me a little bit more of this background, I get that you can't necessarily, fix some of these kind of pieces because there's a federal law that says I have to do it a certain way or something along those kind of lines. But then we're talking about like, hey, do you think it would help if we think about going about it this way? And so not just not listening and fixing things, but just, hey, involving families in how do you think we should fix this? Do you think this is the right way for us to be able to go so that we're really fostering that engagement? And that applies whether I'm working with the staff in my office, whether I'm working with the patients in my individual kind of visits with families, or when I'm doing this patient family advisory stuff. Because you can imagine it's not fundamentally all that different. If somebody comes in with their sprained ankle, it's a little bit of the discussion of like, hey, what are you hoping to do? Or we'll use the concussion just since you mentioned from that standpoint. Like if you're involved in sports, it's different than if you're not involved in sports. If you have finals this week, it's different than if you're on school vacation this week. And so getting a chance to be able to say like, hey, here's what the issues are. Let's understand, what things we need to work around, and then come up with, a engagement plan so we can follow up. So if I create the world's greatest plan, but the teen or the family walks out being like that, I don't like that plan. Well, then we're not going to get anywhere. I might be 100% right from a medical standpoint, but that doesn't matter if I don't create that therapeutic relationship and I get the buy-in and engagement from the family. And so it's really a similar analogy when we're doing the family voice things with regards to our practice as a whole, that we want to make sure we're listening, understanding where families are, meeting them where they are, and then coming up with a plan that works around whatever our limitations or what we can control and what we can't control kind of thing.
It's amazing because I'm hearing you talk about various levels of conversation, the systems level conversation, the office level, patient interaction level. And Robin and I talk a lot about the fact that voice is two sides coming to the table, both of which have to listen and talk. But if one side's not talking, there isn't much listening that can be done. So how can you and other medical professionals encourage families to engage in conversation with providers?
Yeah, that's an interesting challenge because I'd say, just using, again, our patient family advisory committee as a just small analogy, it started out with families that are all connected to me in some way, or the other medical person who was involved at the time. And so almost all of the patients and families were folks that had directly worked with me or directly worked with, it's Dr. Lisa Plotnick is the other one who's another phenomenal champion with regards to patient and family involvement. And so they were all directly tied to us. And well, that's great, but we're getting families who have a ready voice, who already feel comfortable talking to that individual medical professional anyway. And so it's not a big step to ask them to be able to kind of chat and they know their voice is going to get heard and kind of go from there. But how do we kind of garner the voice for folks who, aren't necessarily ready to be able to speak up? So I think sometimes what we end up doing is things like we can often use negative experiences as a way to kind of spin this into a positive. So we actually end up using our patient orientation and patient relations folks a lot. So, families that reach out because they have a concern over X, Y, or Z. You can usually identify when you're hearing families mentioning, negative experiences, who might have that mindset of like they're recognizing that might be a systems issue here or a clinic issue here. And you can often be like, that's a really important point. We have a patient family Advisory Committee, where we'd love to hear feedback about this kind of stuff. And you can really get your voice heard and get a chance to have this be a change for good kind of thing. And so taking advantage of those negative experiences that families voice to be able to kind of move from there. Now, that again requires the family to initially have voiced something. To get to the families that don't necessarily do that, I think that's where you have to do a little bit of kind of self-assessment within your group to be able to say, like, what voices are we not hearing? And so, for example, families where English isn't their native language obviously comes up as a major piece of that process. So one of the ways that we went about doing that to start with is actually we connected with, we used to have a lot of, kind of, this is the interpreter we used for the Somali population, or the American Sign Language, kind of a translator who works with a whole bunch of these kind of families. And so we actually reached out to some of those translators and said, kind of talked about, like, here's what we're trying to do. Would you be interested if you happen to be somebody who feels like, that they're interested in doing that kind of thing? Or with the families that you talked about, who's kind of might be kind of a representative of that voice that might be able to kind of help us out and kind of figuring out ways to get access to some of the communities that we may not be hearing from on a regular basis. I think the same thing for kind of the community of folks with special healthcare needs, that sometimes we get phenomenal voices, sometimes we don't, depending on the scenario. So that's where I think doing a little bit of a self-assessment to realize, like, hey, who's not represented at the table at the moment? And how do we make sure that we can reach out in as, an inviting a manner as we can come up with to, invite them to kind of that table. We ask New Hampshire Family Voices for their opinions on how to better do that regularly. For example, a teen voice has been something we've been attempting to do for a long time. And as is the case with teens on a regular basis, we get a voice for a little while and then they move on to bigger and better things. And then we lose that. And then we have to try and get another one. And then, they move on to bigger and better things. Some of those will consistently be something we have to think about and strive for optimization and improvement with. But it's a difficult question that we continue to have to work on.
And let's flip the lens a little bit. I know you have 2 daughters. How do you handle family voice in your own life? How are you helping your own family?
As a parent, I think in general is trying to find that fine line between, we naturally want to fix all of our child's problems. And so how do we figure out that line between, okay, hey, I can help with these pieces, but there's some other pieces I want you to advocate for yourself. And I'm going to support you and help, kind of teach you through how to do this. But I want you to learn how to be able to do those kind of things. Like, if you don't necessarily like a teacher, I'm not going to jump in and fix it so that I change every teacher you don't like. That isn't necessarily an appropriate kind of request for us. So how do we think about advocating a little bit differently? We need to think about a different approach for our learning or something along those kind of lines. I'll assist, but how do we go from there? But I also want our children to learn how to do that. And if we're consistently solving those problems, then we're not necessarily giving them the skills to help figure out how to advocate for themselves over time. And a little bit of that analogy kind of gets back to the professional stuff that, like, hey, how do we work with families so that they feel more comfortable to advocate for themselves consistently? We do this all the time with teenagers, just that same thing with the concussion piece, or we do this with like med checks for ADHD, for example. I spend a lot of time talking to the teenager, what's your opinion? And I'm purposefully semi-ignoring the guardian that's right next to them kind of thing. And then, like, hey, I will now ask the parents and your guardian's opinion as well, but I wanted your opinion first, because, that's who's important here, that, hey, I will listen. I won't ever make you do something you don't want to do, but as long as you tell me what's going on, then I'll listen and we can kind of do this other piece. So that's our 2 parts of that equation. Your job is to, kind of give me a little bit more of that message. I promise to listen, not interrupt you, and then see if I can kind of implement whatever we've kind of come up with, and we'll work together to make sure we got a plan that we agree on, kind of thing. And that's kind of the same thing I'm trying to do on the parental side, so that I get a chance to be able to do that kind of thing. So that's the one I will say I struggle a little bit with as a medical professional. We're trained to problem solve. I mean, that's essentially what we do. People come in, they can voice certain various concerns, and we're trained to kind of solve those problems. So I have to shift things a little bit when on my personal side to be able to say, like, okay, could I do that? And then the question is, do I really need to? Or am I the right person to do that? Or should I be advocating for somebody else whose voice or message might actually be stronger and more, impactful than my own? Medicine, although patients and families don't think about it, is a consumer business. They have so much more power than they think they do with regards to some of this. When we are looking for division or even upper level changes, when I get a chance to say, hey, I chatted with the Patient Family Advisory Committee and they universally thinks we need to address this and this. They don't know it, but as soon as I say that to upper management, they just changed the triage as far as how quickly that gets addressed. That was on the list at the bottom of the top 10. It now just got bumped up to the top 2 or 3 because we got the patient and family input to be able to do that. And so just getting families to realize, no, not only do you have a voice, but it's actually extremely powerful.
Dr. Shessler, it's been an absolute pleasure talking with you at length about Family Voice. Thank you so much for joining us.
Yes, Dr. Shessler, thank you so much. It's always wonderful to hear you put Family Voice in a context that's really easy to understand. We really appreciate your partnership on this project.
No problem. One other thing, if you don't mind, the biggest reason to do this is because it's fun. It's not fun to just go in and basically, like, the reason I get into pediatrics or primary care is I like to talk to my patients and families. Like, hey, I could have worked in the newborn or the NICU and taking care of NICU babies, which I love doing too, don't get me wrong, but those patients can't talk to me. I do this because I like to talk to families and interact with families. And so this is really a natural extension of that same piece. Like, this is what good care looks like. And so it makes sense to do that in an individual patient and family interaction. And it makes just as much sense to do that on that system level and department level and clinic level, because that input is just as important and just as powerful in those other pieces. And frankly, for too long, we haven't necessarily recognized that and taken advantage of that input.
Well, if you're accepting new patients, I got 2 raccoons I want you to look at.
Perfect. All right. Take care, guys. Bye-bye.
Also, before I forget, Robin and I will be presenting at the New Hampshire Children's Trust 9th Annual Summit, Parents Lead the Way, on September 22nd, which will be digital. So please sign up by visiting newhampshirechildrenstrust.org. And Robin, thank you so much for co-hosting. Let's do it again sometime.
Yes, please. I'd love that.
Many thanks to New Hampshire's Office of Social and Emotional Wellness for sponsoring this podcast. Started within New Hampshire's Department of Education, the Office of Social and Emotional Wellness consolidates policy development and implements projects and programs that are focused on health and wellness with an emphasis on behavioral health of all students, youth, and families. To learn more about the Department of Education and its many programs and approaches, visit www.education.nh.gov. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.